Good day, everyone. I'm Pooja Joshi, your host for today's episode. In this session, we focus on a condition that is common yet often misunderstood: irritable bowel syndrome, or IBS. To help us navigate this important topic, we are joined by Dr. Arun, gastroenterologist at Apollo Hospital, Chennai, a respected expert in functional gastrointestinal disorders. Today, Doctor will walk us through early symptom recognition, simplified diagnostic approaches, and effective, evidence-based management strategies for IBS in routine clinical practice. Doctor, thank you for being with us. Let's begin our discussion.
I'm Dr. Arun, consultant gastroenterologist practicing myself mainly in Apollo Main Hospital, Greens Road, Chennai.
So, doctor, question for you is, what exactly is IBS and how would you describe it in simple terms to a non-specialist?
IBS is nothing but irritable bowel syndrome. What do you mean by irritable bowel syndrome? Means in case if the patient lands with evidence of abdominal pain, altered bowel pattern. Sometimes the patient may have diarrhea, sometimes the patient may have constipation. And when we are doing a screening endoscopy, the patient doesn't seem to show any major alarming picture. So you need to identify that irritable bowel is a problem which will persist for lifelong most of the patient, and it is only controllable, not curable. Irritable bowel syndrome.
Why do you think IBS remains one of the most underdiagnosed gut conditions in India?
Because most of the patient will not see the gastroenterologist in prompt time. Some patient may have more and more presentation, they will miss a gastrointestinal problem. Because in Indian scenario, if you have any cardiac events, immediately they will seek a gastro opinions. But in case most of the time the patient will be landing up with evidence of abdominal pain, vague symptoms, bloated tummy, or sometimes the patient may have obesity, or the patient may have diabetes, or the patient may have thyroid related problem. These kind of multiple comorbidities the patient may land up. And most of the time in Indian scenario, they will take it in a very linear way, and they will not be coming to the gastroenterologist at prompt time once the patient is going to have a alarming pointers like a bloated tummy and other events. Only then, because it still remains in the tip of iceberg. That is why most of the patient misdiagnosed or not diagnosed irritable bowel syndrome. Because irritable bowel syndrome, if you want to diagnose, you need to have a proper GI surveillance, proper blood panel, proper ultrasonal assessment and all those things. Apart from that, everything confirms that the patient doesn't seem to show any major alarming picture. It is called irritable bowel. How far in India, it is still a questionable way to progress in such a high manner. That is why irritable bowel syndrome still remains a questionable target to most of the general population in India.
In your experience, how does a typical IBS patient present in an OPD?
Most of the irritable bowel syndrome, 50% of the population, they'll be having GI symptoms, gastrointestinal symptoms, which means abdominal pain, bloated tummy, the patient may have diarrhea. Most of the time, the patient may have worsening of symptoms. From morning till evening, they'll be going to the toilet, spending most of the time in toilet. Or the patient may have constipation. They'll be sitting in the toilet for longer time, but they will not evacuate the bowel completely. So they may have mixed pattern. Some patient may have diarrhea one day, some patient may have constipation other day. So like that, the mixed pattern of symptoms may predominate. In Indian scenario, you will be getting all these common symptoms. So if you want to diagnose this, it's still a difficult task. Apart from that, if the patient experience this kind of presentation, they need to recognize early to tackle irritable bowel syndrome in a proper way.
How does modern lifestyle food habits, stress, and sleep contribute to IBS?
Because the stress is one of the most common confounding trigger factors for your irritable bowel syndrome. That is why once, for example, in a school-going child during exam time, the child may have increased bowel symptoms. Why such things happen in India is a common scenario because of irritable bowel which is happening. And most of the time in pediatric age group, it will not be recognized much as the age progresses. For example, if the patient is having any bad habits like alcohol, smoking, tobacco abuse and other things, or if the patient is having morbid obesity, if the BMI, if it tends to be more than 30, or if the patient is having type 2 diabetes, or if the patient is having metabolic syndrome like fatty liver, hypertension uncontrolled. If the patient is having thyroid-related problems, then there is high possibility for this patient to land up with evidence of irritable bowel syndrome. So at that point of juncture, so the stress is most of the time the predominant factor. If the patient is not convincing, right now in Indian scenario, most of the high team members are really landing with this kind of irritable bowel because they'll be doing a new work terminology called work from home. If they are going to do work from home, they will be landing up with evidence of stress-related problems. Once the stress is going to get predominant, the sleep cycle is going to get affected. At that point of time, the patient may have worsening of events like irritable bowel. So the patient will be spending most of the time in toilet, and finally they will seek the opinion of gastroenterologists, which many patients will not be able to diagnose in a prompt way. Even if the patient is going to diagnose, to tackle a patient effectively, to address the problem effectively, is still a challenging issue, even for the best of gastroenterologists, to address this irritable bowel syndrome in a proper way. So, stress, anxiety, depression, all these things will be having a predominant role. So, that's why we need to address each and every problem, right from head to foot, proper examination, proper assessment. Everything matters to tackle this irritable bowel syndrome, which is one of the most common, challenging, difficult, worst scenario which is happening in India.
How important is the patient's history compared to investigations in IBS diagnosis?
Not only in irritable bowel syndrome, any events in the field of gastroenterology, history assessment is very important. We need to take a proper history. How significant is the symptoms? How far the patient is landing up with this kind of events? And all these things is very important to tackle this irritable bowel syndrome effectively. Why? Means because history taking isn't hard. We need to develop that. Then only how significant, whether the patient is landing up with evidence of constipation or diarrhea or mixed pattern, which is predominant, whether the patient is abdominal pain or altered bowel like what I've been discussed, all the events where the pain has been predominantly located, how significant, in which way, in what way it is being traumatized the patient, whether the patient is landing up with the evidence of anxiety or depression or over agitated state, all these pointers, the history taking is important. Various comorbids, as I already discussed, like various metabolic syndrome panel, like your diabetes, hypertension, all those pointers we need to look. Head to foot examination, we need to look for the alarming pointers like anemia, because always if the patient is landing up with evidence of anemia, which means the reduction of blood source, that means the patient possibility to look in favor of irritable bowel syndrome will be in the lower side. Then we need to consider the other possible differential diagnosis like your inflammatory bowel or any other conditions we are missing. We need to look into that. All the alarming pointers, we need to have a detailed assessment in the history. Then only we can able to pinch the diagnosis in a proper way. So history taking is hard. We should not miss. With history, proper assessment, will able to come to the conclusion 60% to 70% of the population. And investigations will only aid you. If you're a good gastroenterologist, the investigations and clinical profile, all these things will be having a significant aid, but the clinical history taking alone will clinch you around 60 to 70% of the population who there is evidence to land up with irritable bowel syndrome.
What are some common mistakes in diagnosing IBS at the primary care level?
The common mistakes are in diagnosing irritable bowel is either over-interpretation, misinterpretation, or malinterpretation. Why means? Because many of the time the patient may not be diagnosed. Simply the patient will be coming to the or routine GP practice and other things. They'll be coming with evidence of bloated tummy, disturbed stomach, bowel habits. They'll be having a routine common GA issues. With this background, they'll be giving a basic medication. But how significantly we need to look for the history. We need to see whether the patient is landing up with any alarming pointers like evidence of weight loss, or if the patient we are feeling any abdominal mass, or if the patient is having any swelling in the tummy, or if the patient is having any other worsening of swelling, events like blood loss, significant weight loss, or if the patient is having any evidence of GA bleed. See, gastroenterology looks to be very simple, but tackling gastroenterology issues is very complex. That is how gastroenterology will differ from cardiology, because cardiology will be acute presentation, and in gastroenterology, most of the time will be a chronic presentation. We can able to control the symptoms not only by medications. We need to give medications. We need to control the anxiety. We need to counsel them, the life, the energy, the contribution. Everything is important to address this irritable bowel syndrome. That's why most of the time it will be a difficult task to challenge. It's remaining still a challenging issue, even if the patient is going to take a medication. medications alone won't be suffice to tackle this irritable bowel syndrome, because 30 to 40% of the population, even with the best of medications, will not respond. Medication's role will be only 10 to 20%. Your diet, your energy, your attitude, your all the confounding factors you need to treat properly to tackle this irritable bowel syndrome effectively. Along with your diet and lifestyle modification, significantly to be addressed, and you need to keep your energy level in a very, very high manner to tackle this irritable bowel syndrome effectively.
Are there any warning signs where a physician should immediately refer to a gastroenterologist?
Always, not only for irritable bowel syndrome, in gastroenterology, the warning signs from head to foot looks to be very, very simple. If you're going to look for warning signs like your neurology or cardiology or other respiratory, the warning signs in gastroenterology is very simple. If the patient is having persistent vomit-like symptoms, always you need to be careful. If the patient is having persistent altered bowel habit, considering the age more than 15, we need to be very cautious. If the patient is having obesity, diabetes, hypertension, metabolic syndrome, fatty liver, all these pointers, these are warning, alarming pointers. We need to look into that to tackle irritable bowel. Apart from that, if the patient is having blood loss from your upper GI or in lower GI, in case if the patient passes blood in the stools, it is alarming pointer. If the patient passes blood in the stools, the possibility for the patient to land up with evidence of irritable bowel will be low, because irritable bowel means the patient gut will be irritated, the patient mind will be irritated, but the patient inflammatory cascade like your blood loss and all alarming pointers will not be there. In that way, we can able to diagnose this irritable bowel syndrome promptly. So any blood loss source, if the patient is having weight loss means if the patient dropping in weight rapidly. For example, if the patient remains 60 kg within a span of time, if the patient drops in weight by around 6 to 7 kg in a span of month, which means it's the alarming pointer, which clinches, we need to be very cautious. The patient needs to be evaluated promptly by a gastroenterologist to look into the diagnosis of irritable bowel syndrome. Is there or we are misleading with, because most of the other problems like your colonic malignancy, colonic cancers, it's very dangerous. We should not miss. And apart from inflammatory bowel, it's very common scenario in India. Nowadays, not only in Western population, in Indian scenario, inflammatory bowel remains very, very high. So we need to diagnose all this prompt presentation to tackle. So alarming pointers like all these things we should not miss to address this presentation effectively.
What's your opinion on the role of rifaximin in IBSD? Where does it fit best?
See, the role of rifaximin in IBSD is still a definite good molecule we can consider, but rifaximin alone will not be sufficient. Any patient who had evidence of diarrhea, predominant irritable bowel, the diet and lifestyle, we need to take for low FODMAP diet. The fructooligosaccharides level is supposed to be low. So address the sugar, take care of the diet, address the milk pattern, control the lactose intolerance, control the fructose, control the sucrose, all these components you need to get addressed. So the diet, lifestyle, physical activity, how active is the patient, like what you're addressing for the fatty liver, all these things we need to control, alleviate the stress. So we need to control the stress factors. So the patient may deserve anxiety too. All these pointers we need to address to tackle irritable bowel. Along with rifaximin, definitely a safe derivative we can consider for a duration of time to tackle this irritable bowel syndrome still more effectively.
How important is patient counseling in IBS management? What key messages do you give?
Regarding patient counseling, in case if the patient is having any GI symptoms, first thing we need to see the age of the patient. The second and most important thing is we need to see whether the patient is predominant male or female. The third important thing is how significant is the symptom, which is the predominant symptom, whether the patient is having altered bowel like various diarrheal pattern or constipation predominant irritable bowel, or if the patient is having pain predominant irritable bowel. All these factors we need to see. Where is the pain located? Whether the patient pain is organic or is non-organic. All these things we need to see. Whether the patient pain is dangerous or not dangerous. Whether the patient pain needs to be hospitalized or not needed to be hospitalized. All these pointers we need to see whether the patient deserves emergency care or not. That is all. We need to counsel the patient. So diet, lifestyle, proper management, everything is important to tackle this with the patient.
What's the role of diet? Do you recommend low FODMAP, fiber modification, or any particular dietary pattern?
Low FODMAP diet is very classical diet pattern that has been frequently been followed, but in Indian scenario, we need to educate the patient for low FODMAP diet. That is very, very difficult because even for most of the doctors, it's very difficult to identify what is low FODMAP diet. So we need to educate the public. So low FODMAP, it's very important. We need to address most of the time. Always we should remember the complex carbohydrates like high in sugars, high in milk, high dietary proteins content, and high fatty substitutes. All these pointers we need to reduce. Take care of the diet and lifestyle. Even in fruits also, no sweetened beverages, soft drinks, hot drinks, all these things, and avoidance, control the smoke, control the alcohol related events. All these pointers you need to address to tackle low FODMAP diet is having a significant potential role to tackle this irritable bowel effectively. Thank you very much. It's really a great pleasure for me to join in this discussion on irritable bowel. Thank you very much.
Thank you, Doctor, for sharing such valuable insights on IBS. Your clarity and practical guidance will certainly help both physicians and patients approach this condition with more confidence. To our listeners, thank you for joining us. Stay tuned for more expert-led conversations. Until then, take care and prioritize your gut health.